There are two matrons, a senior matron and myself. They have a very big team as well. We have a care group manager in Neurosciences too. We incorporate all sorts of conditions in neurosciences. We have a hyperacute stroke area, a rehab stroke area, neurology, neurosurgery, an acute admissions area which encompasses neurosurgery and neurology, and a new spinal unit which is opened this month, which will be taking all acute spinal admissions to. There are plenty of opportunities for newly qualified nurses up to experienced nurses. We offer a range of courses for those nurses. They can come and do either a Foundations in Neurosciences course all the way through to a Masters in Neurosciences as well. So we offer plenty of training opportunities too. We have our own in-house nurse practitioners who have done plenty of training, and we'll do some training, on-the-job training with nurses as well. We have Band 2 programmes that we run courses for, and some of our Band 2s have now progressed to Band 4 nurses, and some of those have gone on to do their foundational degree nurse training, so they've worked their way up from a Band 2 to a Band 4. Band 4 nurses are relatively new. They've come into the trust in the last 2 to 3 years. They sit alongside the registered nurse and can perform a variety of roles, administering drugs, IV therapy to patients, and are very experienced and utilised part of the team.
I enjoy coming to work at UHS as I enjoy the people that I work with. I really enjoy the area I work in. I find it a very supportive area to work in. I think they're really good if you want to kind of progress with your clinical skills or progress in your career pathway. I've just started the neurology course, which I'm really looking forward to. My most rewarding moment at work is probably seeing myself excel from being a newly qualified. I've been here nearly 2 years now, and last month I got Employee of the Month, which was really nice. It was something I wasn't expecting. So I've recently done a secondment onto surgical board, neurosurgical from neuromedical, and I found that really educational, really nice to kind of learn about the different areas in neurology. I would say to those thinking of joining UHS to come, I had the chance to go to a couple of places. When I came to interview here, I really liked the staff. I felt really at ease straight away. I felt really supported. The preceptorship programme that we were offered was really, really good. We met all like the managers like quite early on, who were really nice. Just because in terms of you want to progress, you can. If you need like support, there's always support there. And yeah, that's probably why.
I would recommend UHS as a fantastic place to work. The opportunities for developing your career are fantastic. It's a really diverse range of staff and patients, a massive hospital covering a massive group of patients across the south with several specialties that are only found in Southampton. I would recommend joining UHS to anyone who wants to further their career in whichever medical profession or profession that they wish to be part of. There's an excellent system of support from both peers and managers, and there's excellent opportunities to further yourself both clinically and academically with excellent study days and support.
I trained here as a student. I came to the university at Southampton. I think before that I didn't really know what I wanted to do. And as soon as I started my job, as soon as I started my placements at the UHS hospital, I absolutely loved it. I love the team that I have working with me. I love the patients. I love the type of patients that I look after. And for me, that it has a massive influence on my life at the moment. I think for me, as one of the managers, I think it's actually seeing my students progress. And so the students that I've had coming onto the ward to become sort of qualified nurses, and I think seeing them progress and seeing them go through university to do sort of postgraduate courses, to do their mentorship, to do their neuro courses, for me that's quite a rewarding moment. If they wanted to join UHS, I'd say go for it. I'm very I have lots of friends that are nurses, and I have lots of friends that work in other hospitals doing other jobs, and they don't seem to get as much satisfaction from it as I do, as I get from my job and being in this environment. When I recruit staff, I'm looking for somebody that's enthusiastic, somebody that I think would actually, it's quite difficult, but somebody I think who's going to work well as a team. And I think sometimes the way they present themselves is quite a massive influence. But for me, it's about their personality, and it's about what I think they're going to be able to provide, that extra little something to the team that we've already got. I'm passionate about neuroscience nursing because of the patients that we look after. They are very complicated, but very interesting. It's very challenging, but also very rewarding. And I never go home thinking that the day has just been like any other day.